Well, thanks very much for coming to see us, Wendy. One of the immediate problems that's bugging us is with practice inspections and CQC. It seems an absolute minefield. Have you got experience of this?
I've got extensive experience in CQC inspections, and it's not something to be scared of. It needs to be just organised, preferably if you've got a good practice manager who's very well trained. I do business coaching for practice managers, and one of the things is to help them get together the practices, processes, procedures, policies and systems, and help them to get them organised and documented. Make it a patient-centred practice, because that's one of the things that CQC are looking for, is that you're involving your patients in your practice, how to do that with patient questionnaires, suggestion boxes, that type of thing.
Something that we've really neglected is adequate staff training, and you made it very clear that this is very important, and I would agree with you. Can you help us in a hands-on capacity doing that?
Actually, on-the-job training with practice managers especially is something that I find very, very rewarding, and I've had extremely good feedback from quite a few practice managers that I've recruited either from dentistry or from business management, retail. They come into dentistry and I've trained them from scratch. And also promoting dental nurses or receptionists to practice managers' positions, and all the aspects of the job, really.
The other thing that rather bothers me is that we've talked to accountants and the banks and various other consultants, but none of them have actually had direct wet-fingered experience of dentistry. But I believe you have, is that right?
Yes, I have. I'm actually a qualified dental nurse. I did my dental nursing about 15 years ago now, so I do have empathy with the clinicians in the practice as well as the administrative staff, and I do really find that helps me to understand things from their point of view. A really important part of running a dental practice, running a dental business, is the financial side of it. You've got to analyse your costs against your income. And what a lot of practices do is they think, right, we need to order materials on a monthly basis, we need to pay the staff wages, we pay the associates, but they're not actually analysing how much as a percentage those costs are. There are benchmarks that you can work to for your laboratory costs, your staff wages, your associates pay. And those have got to add up, because otherwise you can be working flat out every hour of the day and think, yes, we're doing great because we're really busy, but as you say, you're not making any profit.
I was thinking about associates. This isn't working very well. They seem to be a bit of a law unto themselves.
They obviously don't feel part of the business. They feel as though they're probably working as dentists within your practice, as opposed to being part of your practice team. How much do you involve them in the running of the practice? Do they know what they need to be earning on an hourly basis to break even? Do they sort of look into things like practice events? Are they interested in going on courses for the benefit of themselves and the practice? How much do they feel as though they're sort of valued in the practice as the clinicians, really? In the practice team, everybody is equal, but everybody has to recognise the fact that they need to buy in to the practice aims and objectives, and do they know them, or, as you say, it sounds as though they're just sort of like working on their own at the moment.
How would we go from here? I mean, what kind of hands-on help can you provide, and how long do you think you could be with us?
Well, I like to go into your practice office with your practice manager or your administrator, and first of all look at the office. How can we get it organised and as tidy as possible? I then like to chat to all the other members of staff and observe the patient journey, and just generally observe how the practice is working and the problems and issues that I can see. I would then go away and put together a report identifying where I think things are not working as well as they should be. Things generally go very well whilst I'm in the practice. The day after, there's generally a problem. It depends on how the staff respond to the changes, because quite often change will need to take place within the practice, and resistance to change is a common problem in all practices, and it's managing that change as well, which at those times I do like to be really hands-on to to manage that change so that you have a smooth transition instead of just like leaving you to it, because that just doesn't generally work.
Well, thank you very much, Wendy, for coming to see us to help streamline the business and iron out some of the problems that I think we're experiencing.
Wendy has provided some great team building exercises for us. It's really boosted morale in the practice, and I really do look forward to working with her in the future.